Hi, Vic Gatto. Thanks for watching the Healthstorm. Today I have Steve Tremitiere. He's a friend of mine and a partner in my business, but he really has tons of knowledge about healthcare. He's been involved in early days of population health, really incredible amount of knowledge. It's a great show. Please watch Steve Tremitiere at the Healthstorm. Thanks a lot. Okay, welcome everyone to the Healthstorm. Steve, thanks for doing this. Really appreciate it.
Absolutely.
So again, we are in the midst of COVID-19, talking about the Healthstorm. Steve, just give a little background of your kind of what you've done before Health Further, and then what your role is at Health Further right now.
Sure. Yeah, absolutely, Vic, and I appreciate the opportunity. Yeah, just to summarize, I guess my background, I've always been entrepreneurial. Whether it was as part of an organization or having my own business. So I've always worked with young companies and with startups and realized that I loved helping new organizations get big organizations to do new and innovative things. So that was just a path that I kind of fell into, and then I did consciously, for the last 20 years or so. The vast majority of that, the first 25 years, was in the tech space. The last 10 years of that in mobile. So doing, some things that today we think are just, we take for granted. Having to convince people to do things that we now think are just everyday parts of our lives. And then about 5 years ago, I got into the health space and got engaged working on a number of different moonshot programs. Probably the most significant one was working with David Feinberg and the executive team when David was the CEO at Geisinger on a project that became Springboard Health, which was and is a moonshot initiative to address population health at the level of an entire community. So in this case, trying to get Scranton, Pennsylvania as a community to adopt programs and integrate solutions and break down silos so that the overall health of the population would grow. And in addition to that, I've worked with a number of different for-profit and nonprofit organizations that focus on population health and social impact. I had always been looking for an opportunity to get into the investment space. But it took me a long time to find an organization that I really felt comfortable with. And it was, I guess now about 18 months ago that I met Marcus and you and, and the rest of the Brio team and realized that, this was an organization that was aligned with my principles and what I wanted to do. And so really excited to be a part of Brio and Health Further, where I'm involved as the Chief Development Officer.
Yeah, excellent. So let's go back to Springboard. So explain that a little bit more. So the entire city of Scranton, I understand why you're saying it's a moonshot. Like moving that entire city to be more healthy. How do you approach that? How do you start that?
Well, I think there are a lot of different ways to do it, and there are a number of programs out there trying to do that. We had the advantage of the leverage of the health system, which is also the largest employer in the region. So obviously people took us seriously, but we really had to we spent 2 years in the community building trust, making sure that the people in all the institutions, whether it was education, the business side, the nonprofit side, neighborhood organizations, all understood that this wasn't something we were coming in and trying to dictate, but it was something that had to be built from the ground up. And so that's what we did, was we listened, we focused on programs that we thought were fundamental to what needed to be done. And the vast majority of them were in the population health space. So trying to keep people healthy before they get sick. And a good example of that is the Fresh Food Pharmacy, which has been incredibly successful, where provide healthy food at no cost to people that are suffering from severe diabetes. And the results of that program have just been astounding, because it provides not only food, but it provides peer support, wraparound services, and as made it clear that you can, with a relatively small investment, really be able to move the needle on a program like that. And then involving, as I said, really everybody in the community in looking at what projects need to be done, and not assuming that just because something isn't in someone's wheelhouse that they shouldn't be engaged, because some of the best ideas that we came up with came from people outside of whatever that, that domain was.
Yeah.
So it was really about building community engagement and momentum, and then getting the people involved to really take over the programs and make them happen.
Interesting. Okay. And then Inside Health Further, you just launched a thing called the Hero Network. Really, I think it was in response to COVID-19. But talk about what you saw in the outbreak and in the hospital systems trying to deal with the outbreak, and then what the Hero Network is supposed to do.
Absolutely. Yeah, so beginning in February, it became really obvious that business as usual wasn't happening. And so we looked at our network. We looked at the people we work with every day who tend to be executives within healthcare organizations, and realized that they were desperate, and they were desperate for, in some cases, for PPE and actual physical goods. In other cases, they were desperate for best practices, and we're looking to figure out how to handle a situation that nobody had ever been through before. So
you have 5,000 hospitals around the country all trying to figure this out, and no real easy way to share best practices, share equipment, share anything.
Exactly. And that, I mean, that's a theme for me anyhow, is the lack of collaboration and learning in healthcare in general. And by the way, we also engaged our partners in the UK in this, who were facing many of the same issues. So this is a multinational effort. And we realized we just needed to do something very simple, which was to stand up a platform where all of these people could come and say, I need help, or I can provide help, or I've learned something that I think everybody else needs to know. So it became an information sharing hub where they could come and be able to engage. And in some cases, we would get involved directly. There were a couple cases where we very actively went and found PPE and testing machines. And I think because of the way we did that, the network actually did help to save lives. And we're now
you moved PPE or testing equipment from where it wasn't even being utilized to where it was desperately needed.
It wasn't being utilized, and it also, there's, as we all know, there's a lack of any real coordination in all of this that's going on right now. And so we helped to provide some of that, and we were fortunate enough to bring the type of people into this group that want to be able to share, and we're looking to help out. So it was a matter of saying, here's what we need, how can you help? And people stepped in to make it happen.
Yeah, excellent. Okay, and so as you know, this is called the Healthstorm, right? And a few months ago, probably around 7 months ago, I was thinking, and you and I have had long discussions about this, that there are multiple trends coming to sort of change the way the health system works. And I had it as a sort of slow-moving storm, more like a hurricane or something that would come over the next 3, 4, 5 years. And so the name of the show is the Healthstorm, with the idea to try to give people awareness of what's happening. And that seemed like a good idea at the time. And then COVID-19 has sort of come, and it seems like, the storm is here right now.
Yeah.
And all of a sudden, a lot of these trends that were kind of slowly building over many years all seem to be accelerating. And so I wanted to sort of talk to you about those trends and get your take on, are they real? Which one is more impactful than others? So the four are kind of the rise of the consumer. So consumers are trying to rise up and take control of their own healthcare. Care moving out of the hospital. So it used to be that all care was done inside the four walls of the hospital. That's fracturing now, and it's going to the neighborhood and the home. I think technology and wearables and data and telehealth and artificial intelligence is coming to healthcare and sort of enabling, but also making challenges to the incumbents.
Right.
And then there's market entry from people that are not traditionally thought of as healthcare. I mean, where David is right now is at Google. Google is making a big push into healthcare. But it's not just Google. Apple, Amazon, Salesforce, Walmart, Kroger, they're all moving into healthcare.
Right.
So these are the four trends that they've really been coming since before COVID-19, but they were very slowly moving. And I see them now as being accelerated. What are your thoughts about those trends and the changes in general?
Yeah, well, the first thing I would say is that right now, I like, and we can differentiate health and healthcare. I like to say health because I like to include health and wellness and,
Sure.
and population health in that. But, to use your Healthstorm analogy, I guess if you precede the Healthstorm with a 50-foot high tsunami wave coming through and then a storm coming in behind it,
Yeah,
I think
that's probably where we are. Yeah.
right. I think that's what's happened. And we knew that healthcare was being disrupted, as you say, for the 18 months that we've been talking. We knew it was very clearly already happening, and there were a lot of signs in it, whether it be the tech giants moving in or some of the other trends you mentioned. They were already happening, but we were thinking it was going to take 3 to 5 years to get there because of the inertia in the system and the power of the current process. And what's happened is that, in 60 days, 5 years of change or more has taken place. In fact, we know of organizations that literally have taken their 2025 strategic plan and said, okay, this is what we're now implementing, which is incredible. And I think that, as much as everybody would like to say we'll get back to normal, whatever is going to be normal isn't going to be what it's been before. So, so those that are willing to understand that and take advantage of it, I think are going to have tremendous opportunity. And there is absolutely already systematic change and system-wide change taking place. I mean, and we can talk about some of the individual drivers if you want to
talk about the timing of things. 'Cause I think, not getting back to normal, I completely agree with. I think in healthcare, and particularly in healthcare investing, that of course I'm focused on, timing is really important. Like, you can be right, but if you don't have the timing and the market adoption timing correct, you still lose money, right? So timing is always important. It feels to me like we're in crisis today. We're probably just beginning to, at least in Tennessee where I am, we're starting to open up. Various states are opening at different paces, but we're maybe moving into what I've been talking about as the recovery phase, which is, the wave has already crashed and it's done a ton of damage. And how do we just patch things up and try to recover? But then I think we're going to get to it. I'm calling it the new normal, right? So we get back to a sense of normalcy, but it's not the same status quo that we had at the end of the year, which, amazingly was only less 5 months ago.
Yeah.
But it's going to be very different. So talk about the pace of that. First of all, do you think that crisis recovery new normal fits? And then what's the pace of, how long will recovery take? When's the new normal going to come in?
Well, if I could really nail those, then
we'd be all trading on your account.
Exactly. And I also wouldn't profess to be able to say I can even make an educated guess, but I'll say this. I mean, so there's what I think can happen and what I'm concerned about. From a technology, there isn't anything from a technology standpoint or a system standpoint that would keep us from being able to get to a new normal. In fact, most of what's being implemented today, whether it be telehealth or remote patient monitoring or other things, have already been in the marketplace. They just have not been able to break through because, again, of inertia and
well, I mean, if you take telehealth,
right?
It's been regulation and reimbursement really kind of group stalling for protectivism interests. And when this wave happened and the crisis happened, that got all wiped away.
In like 2 weeks. Yeah.
Telehealth anywhere in the country, and you can get paid for it.
Right.
And we always should have done that, but that was not going to go back. Like, we're going to be there now.
Exactly. And I think that when I talk about concern, I think the transition, for example, I think payers actually are very happy to see some of these changes because telehealth is cheaper for them. It allows them to get more patients paid attention to at a lower cost. So that's great. It's not great for the incumbents that were charging more for in-person visits. So I think that this, the concept of the rise of the consumer and care moving out of the hospital, I think the technical aspects of that are now being cemented in, and along with telehealth is just so much care is moving into the home, right? So there isn't anything revolutionary.
The technical capability is not the bottleneck.
Exactly. It really is. It's implementation, and it's a changing of the business model. Mm-hmm. And so you're requiring. So either what's going to happen is that they aren't necessarily new players, but they are players that were already established in home healthcare and urgent care centers, et cetera, that were already these alternative approaches are closer to patients. Patients feel more comfortable with them. Now that people, the stats are amazing when you look at people who have now had a telehealth session who say, I love this. I don't want to go back to the usual.
Yeah, why do I want to get in my car, drive down, find a place to park, get
exactly
lost in the hospital,
right.
Wait in the clinic, see the doc for 7 minutes.
Right. It doesn't make any sense. Right. But the concern comes in the transition because of the pay model not mixing with the providers, and the wild card and everything is just how many people are newly unemployed. And don't have insurance, or are going to either move into Medicaid or are going to, move into a marketplace plan. Yeah. And, there was just an article in the New York Times today talking about the dramatic changes and the differences in compensation for providers for those different scenarios. So that's where I think it's going to get really tricky, and it's hard to say how quickly, but many of the technology plays are already happening. And I think we're going to see over the course of this year, especially because we're going to be moving in a kind of transition to preparing for a second wave, or maybe just a lessening of the plateau, but I think everybody's concerned about what happens next. The technology tools will make that much easier if we get them in place.
Yeah. So I guess I'm interested in your thought about what happens with health systems, right? So the health systems, they've been ground zero for the fight against COVID. Like ICU and emergency rooms and critical care centers have been where the battle has been fought. And some of the biggest heroes are the physicians and nurses and med techs that are every day risking their own life to run in and help with this.
Right.
And unfortunately, simultaneously, this type of treatment is not that profitable, although CMS has tried to make it more palatable. But simultaneously, all the elective surgeries, all the more profitable areas of the health systems have been either by government mandate or by patient preference. They haven't been doing any of them. There's no elective surgeries. There's no other surgeries that are. There's not a lot of diagnostic work going on unless it's COVID related. And so kind of simultaneously, you have the hospital being the center of the most important thing to help us through this crisis. And the crisis itself is going to weaken them pretty significantly, such that I am worried about how many will not be able to come back. So talk to me about that. Like, are they the center of value for our healthcare system? Or are they like wearing a bullseye and need to be reimagined or redesigned?
So I think that if you look at, if we lump them all together into providers or health systems, obviously there's a great variety there. So for example, integrated systems, even though I think they're taking huge hits right now, they are better prepared because they are both a provider and a payer, and they actually benefit on the payer
Yeah, so
side.
just for the audience,
You
when
know,
you say integrated, you mean they have a hospital system, they have doctors, but they also have an insurance company
correct.
that
Right.
manages lives and have both sides of it. So the biggest is probably
Exactly.
Kaiser Permanente.
Right.
Geisinger does that. There's probably 30. There's several
Yep.
big ones that do that.
Exactly.
Versus a health system that doesn't have that, they only provide care and they rely on United or Cigna or Aetna or someone to be the payer.
Yes. Yeah, and I think they'll end up being in better shape because they are integrated, and so there is some balance there, but also because they're integrated, they also tend to have their own urgent care centers. They have outpatient centers. They do a lot of home health care already. So they've been already working on those efficiencies. So I think they will tend to fare better. They're still going to struggle mightily. The ones that are in severe danger, of course, are the smaller ones, which were already in trouble.
Yeah.
I mean, I know some small hospitals where literally their difference between making money every month and not is 2 patients.
Yeah.
And now that that's the case, there's no way they're going to be able to survive without some help, wherever that comes from.
Yeah.
And then the ones that are in the middle, it's going to come down to, how operationally nimble are they? Will they be able to get back to elective surgery quickly?
Yeah.
But even then, I don't think there's any way that we get through this year without a significant amount of help for all of those players.
Yeah. Yeah. And it's interesting if you are trying to think about how do you help the 5,000 hospitals in a fair way, right? There are some that have payers associated with them, integrated systems, like you're saying. There's some that are very small, but they provide a critical service, critical provider care in that community.
Right.
There are some that are very large, publicly traded, strong balance sheets, and there are some that are nonprofits. And so trying to figure out a support system for the federal government to support these things, there's not a lot of commonality there, right? If you have a nonprofit that has a lot of debt, bond payments they need to make, they're struggling in a different way than a for-profit that's publicly traded and has equity and debt. And a one facility in rural America is different than a one facility in some urban America, but they're both suffering.
Right.
And so I worry about our collective ability to support them in a way that is fair to everyone and also meets the needs in all these different situations.
Yeah, I don't think that I haven't seen anything close to an answer for that yet. And we certainly aren't at the national level coordinating anything.
I'm not even sure the politicians understand the difference.
No, I don't think they do, and that's scary. And I think what is happening right now is we're seeing it in all aspects of this crisis, is that the quality of the response depends on leadership at the local level, maybe the state or regional level. But that doesn't really work in this case either.
Yeah, I mean, the states don't have nearly enough money.
Right, exactly. Right. There just isn't enough money to go around. So there's no way that we're going to get through this without serious pain. I don't think there's just no way that that's possible. My main concern is that we'll continue with this kind of fragmented mess going forward, and it's going to prolong the issues because we're not going to be able to do an effective job of taking care of people. So that's my main concern.
I think maybe that will happen. I'm a free market, I'm an investor, right? So I'd prefer to see the market entry trend accelerate. And there are some, like all those tech giants are gaining strength in these times.
Yeah.
I think the insurance companies are gaining strength in these times. So if you are an insurance company, maybe you there's going to be consolidation in the hospital market in a way that I think is hard to predict, but I think could be pretty widespread.
Yeah. Yeah, and I think that there, a lot of that probably was going to happen. Again, it was well underway already. It probably will be more brutally efficient than it was before, because if hospitals want to stay afloat, they're going to have to become part of a larger entity. So I don't know how that ends up impacting patient experience. And I think, just briefly going back to your drivers, we had really thought that the rise of the consumer and the patient, it was happening because people were getting more control and more access to services in this uncertain time, because we're also, increasing the difference between the haves and have-nots. That is kind of up in the air now too, because it's impacted by the health of the health system. So I think, in the short term, there's just going to be an incredible amount of uncertainty, and hopefully some leadership will emerge to be able to put together some guidelines and best practices that will get us through where we need to be. A good friend of mine who I trust tremendously on the economic side said, basically, you need to figure out how to get your organization to Q1 of 2022. And if you can do that, then you're probably going to be okay. But that's a pretty tall order looking at the 18 months between now and then. Yeah.
Right. Yeah. Okay. Interesting. So that there's still a lot of change to happen. Unfortunately, I think your analogy is right, that the wave has hit us, and there's still water in the streets, right? It hasn't really receded that much.
Right.
But that does not change the fact that there's a storm right on the horizon coming. And I think I do worry about the patients, but I think the patients will be taken care of, like whether it's a new consolidator or existing hospitals supported. But what I think is the most likely to be really problematic is all the workers. I mean, healthcare employs about 13-14% of the population is in health, and we have all this unemployment now, right as we're also going to, I think, start cutting jobs in healthcare. Healthcare has been almost the only place that's been somewhat protected. There's been some furloughs, but it's not protected. But that's going to change fairly quickly, I fear. So
I think so too. I think that we went from, they could not hire enough people. There weren't enough people to work in the industry to that happening. I'm more optimistic that there will be, because of the changes that are taking place. I think it won't necessarily look like it did before. For example, there will be a lot more people shifting into possibly home healthcare work, et cetera. But hopefully we'll be able to get through this part of it and not lose too much of that, because it is still one of those things where, healthcare isn't something where you can just invent a new app and all of a sudden, everything is fine. You still need someone to take care of a person at some level. So that level of expertise is still needed, but I think that's going to be a huge issue.
I mean, if you have to get a catheter put in,
right,
you ain't going to do it with
an app's not going to do it. Yeah, exactly. Yeah. So I think if we can really focus on practical innovation, and I also do agree with you that I think there's going to be a lot of upheaval because of the payment side of things. But from a patient care standpoint, I'm actually optimistic that this crisis will lead to more practical innovation around patient care, and hopefully more of an emphasis on the front end of health and wellness, and trying to keep people from getting sick and developing chronic conditions, because as we know, those are most of the people that are in trouble right now with the virus.
Yeah, well, they're in trouble with the virus, and they also cause 70-80% of the spend.
Right, exactly, at least. Yeah.
Pre-virus. So
right.
That leads to a question I wanted to touch on with you, which is, I think that the new trend in my mind is that public health is going to be a huge focus. Right? Like we all have understood like much more. So, I mean, you and I have been in healthcare, but I learned like how foundational health is just to our society. Like
Right.
you don't have high school without healthcare. You don't
Right.
have business open. You don't have restaurants. You don't have airplanes flying. Walt Disney World closes. Like if you don't have health, nothing's happening. All the sports leagues have closed.
Right.
And so I think that our ability to and our willingness to invest time and energy in public health is going to be significantly more kind of post COVID-19. What are your thoughts about that?
I agree. Yeah, I couldn't guess what the shift in funding will be percentage wise, but I mean that has to take place because going back to the rest of this conversation, that it's not going to come from anywhere else, and the only way to start to get in front of these types of situations is to have better and more coordinated public health. So. I think one interesting thought there might be that the definition of public health may actually change also, because I think today people automatically associate that with government.
Yeah.
And hopefully what we'll start to see will be, and this is something we're really focusing on with our network and with Health Further, is how can we foster this practical innovation and collaboration and sharing of best practices across all of the players to the benefit of everyone. Because, if you look at healthcare, and I'm not talking about pharma where, obviously they need to hold invention close to the vest. For the vast majority of the rest of health and healthcare, it's all about execution and the way that you deliver care. There aren't any secrets that anybody has, but there's no reason why we need to have 500 different ways to address diabetes, or so many different programs that are all trying to do the same thing but that don't collaborate. So I hope that the definition of public health will shift to include more cooperation amongst the private sector and the sharing of information and success, so that we can all move forward and do it quicker.
Yeah, there's no question. It's going to have to be kind of an all of the above solution.
Yeah, exactly.
I think government has to be involved. They have to fund it, but we're going to have to deliver it through lots of different vehicles, just because it's a pretty big need out there.
Yeah.
I do want to explore the idea of expanding the topic to include some wellness pieces and diet, and depending on how people think about public health, it may or may not include that. But I think we have to try to address sort of chronic disease holistically across all the different threads if we're going to really make a difference. But I was on a video a week ago, and a woman that I was talking to had a really good point, which is that will save money and have better outcomes in a long-term view, in a 5, 10, 20-year view. But you're still going to have someone with congestive heart failure need an intervention today.
Right.
And so we almost have to invest more in public health and wellness, and we're not going to be able to change our existing investment in the interventional health stuff. But there's no other way out of the room. If we don't start to do that, then you never get there.
Exactly. I mean, we don't really have a choice. If we want to lower the long-term cost of healthcare, we have to do that. And, short of someone inventing a magic pill that makes everybody healthy, the only way we're really...
That's the American dream, but it's not
Yeah, exactly. The only way we're going to lower healthcare costs is by people being more healthy.
Right.
And and not crossing the line and
they'll have better quality of life, and
that's right,
live longer, and they'll be more productive, and all the
exactly
things are all intertwined.
Exactly. And when we look at things like social determinants of health, there's a reason why there are certain groups of people that are more at risk right now. It's because all of this, as you said before, health doesn't occur in a silo. It's a part of everybody's life, and we all know that the zip code you're born in has a much bigger determinant on your health than really any other factor. So We know all of that. We've known all of that, but we have to have the courage and the foresight to start to shift the investment more to the front end, so that over time we can have a significant amount of impact and savings.
Yeah. Yeah, I agree. And I think that there's a catalyst now to do it. We'll see. We need to try to push through.
Yeah, I would, one thing that I would, and this is something that came out of our Springboard project, I also do think that there is an opportunity and should be an emphasis on increased personal responsibility for health as well. I think that too often, we rely on healthcare to take care of us when we get sick, but we don't take enough responsibility for staying healthy. And there are, there are a percentage of people, of course, who are wearing Fitbits and, going to the gym, et cetera. But the number of people who really don't take care of themselves, and even if they made some minor changes, that can make a big difference. I mean, there's not an easy answer to that because behavior change is so hard. But I think that's an area where we really could experiment and see if there are ways
so
to
how did Springboard focus on getting people to take personal responsibility?
So we started a program, and honestly, I don't know if it's still happening or not, but it's one that's continued to resonate in my mind, that we called Transformers. And basically, the intention of the program is to start with people that volunteer and say, I want to be more healthy, but there are barriers. I can't afford it, or I don't know how, I need support, whatever those things are that are standing in the way. But rather than, I mean, it's impossible to convince somebody who doesn't want to change their behavior to do that. But if you start with people that say, I really would like to be more healthy, I need help, then that's a place to start. And there are some interesting programs around the country that are starting to get smarter there. That's another area.
When you said that in Scranton, did some subset of the population step forward and say, like, I want in?
Yeah. And we didn't get to the point, but other programs are doing this where, if you engage families, for example, then you're going to have more success, because there's, parents are much more likely to do something if their kids are involved than if they're just doing it on their own. So there are a lot of techniques that can be.
When you have that positive kind of social pressure.
Exactly. Right. Yeah. So that's an area I think that's really unexplored that could have a lot of opportunity.
Yeah. Great. So Steve, you've been working in health innovation for 5 or 6 years, working in innovation and technology for longer. Tell me, like, what do you know now that you wish you knew when you started this journey?
Well, it's definitely the case that just because you have a great idea or a great solution, if you don't know how to get it in front of the right people and through the system, that you'll ever have it come to fruition. So understand,
especially in healthcare. Healthcare is so complicated.
The system is just right. Sales cycles are in years, though. Again, that I think is something that's changing. So I think that's a very big piece of it. And also understanding that most of the time, really good ideas don't come from the C-suite. They come from people that are on the ground and that are dealing with issues and situations. So that's where I tend to look for real innovation.
Yeah. I find that someone who invented or thought of this thing to solve a problem they had, like, right in front of them, like, they needed help here. They weren't really thinking about starting a unicorn company. They just needed a problem solved right then. And then they realized, gosh, other people need this too. And it sort of gets momentum.
Exactly.
Those are I know that's the only way you can do it, but that's the most fun way. That's the ones I like to get involved with most.
Yeah. Because they're based on a real need. And so they've been able to figure out a solution. I agree.
Yeah. Right. Okay. Any other trends in health or innovation that you see that we didn't touch on?
No, I think we touched on the primary ones and the ones I think are most interesting, which is, which really at this point are around uh, collaboration. I think we're great at innovation. We're just really bad at getting it, from the point of the idea to a solution that scales. So if we can get better at that, then we can have a real impact. And I think, finally really including patients in healthcare and engaging them rather than having them just feel like they're, they're they're being treated, but they're
Yeah,
not
they're
engaged.
operated on, but they're not
Exactly.
included.
Right. Because that also kind of reduces their feeling of responsibility and being able to have an impact. So I think those are all really important.
Yeah. Okay, and then how do you keep up? I mean, it's a pretty fast moving industry. How do you keep up with all of these themes and trends and topics?
Well, luckily, I'm part of a couple of groups, including ours, where we all tend to make each other aware of
Right.
things. I read everything I can get my hands on, so I subscribe to a lot of blogs, and I try to go through them every day because we're now in a situation where literally things are changing that quickly. Uh, but then ultimately, it's my network that I rely on. So it's people that are actually out there doing these things and are making a difference that I stay in touch with, because that's where I get grounded and that's where I get to understand whether something that I think might be the truth, whether it's actually the case or not.
Yeah, that makes sense. Or maybe like there's a nuance between a couple points that you bat around with someone in your network.
Yeah.
Or
Yeah, because the beauty of it is that everybody is really trying to solve the same problems at the end. The chronic health care issues right now, COVID, et cetera, everybody's trying to deal with the same things. It's, who's doing it best and how can we get the word out there?
yeah. Okay. Well, thanks, Steve. I appreciate you doing this. It was fun to
But
talk
thank
through.
you. Likewise. Thank you.
Okay. Have a good
All
afternoon.
right. You too.